The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.
Welcome to another episode of Live the V-Life with Dr. Annie. Today we're going to talk about tilt table testing. Whenever I mention this to my patients, they kind of look wide-eyed at me and they think that I'm going to put them on a table that just goes 360 degrees and round and round. And that's not the case. Tilt table testing is a great way to look for autonomic dysfunction. And it basically involves a patient laying on a bed for about 30 minutes where we check vital signs such as the heart rhythm, the blood pressure, the oxygen saturation. And then we raise the bed, we raise the head of the bed basically, about 70 to 80 degrees. And the patient is strapped onto that bed, so don't worry, you won't fall off. And I'm watching you the whole time. So it's not a scary test, but it does give us great information with regard to what happens to the blood pressure when a patient is standing for long periods. What happens to the heart rhythm when a patient is going from a laying down to a basically upright position. Many people will come to me with symptoms of dizziness all of a sudden when they're standing, or when they're sitting for long periods, or fainting actually, or chest discomfort, feeling palpitations. So the tilt table test is a great non-invasive way to measure what happens to the patient in multiple positions. And once we know if the heart rate is going too fast, or maybe the blood pressure is going down when the patient is in the upright position, we can easily treat that. So many patients are plagued with feeling dizzy, having palpitations, fainting, and these are young patients, not just older patients, young patients who have autonomic dysfunction. I have several instances of flight attendants or pilots who come to me saying that they just feel dizzy or they actually fainted. And so I've been able to take care of them, do a tilt table test, find the problem, and actually treat it with medications or natural therapies, which we have in our center, both in Houston as well as in Dubai. So read about autonomic dysfunction, read about the tilt table test. Don't be afraid of it. Come and get your heart checked out, because again, preventing the problem is the best thing. Reversing the problem is the next best thing. And finding what's wrong with you is the most important thing. You want to live a long, healthy, happy life. And so if you know that you have autonomic dysfunction, come get a tilt table test, come be evaluated.
The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.